Chronic pain, mysterious, invisible, complex. It destroys lives and causes unimaginable suffering. But now we're on the verge of new understanding, targeting the agony of cancer, watching the brain's response to pain, zapping the spinal cord with electrical current. These are just a few of the 21st century weapons used against this ancient enemy. Pain specialists wage battle against chronic pain. Next on Killing Pain.
Okay, relax and take some slow, deep breaths. Just exactly where you heard it, sir.
Pain. We can't survive without it. When we break a leg or cut ourselves, the pain system sounds the alarm. When we come too close to a flame, the pain system warns us of danger. But for some people, the alarm never shuts off.
You can't remember what life is without pain?
My bones are made of glass, and all of a sudden they are hit with a baseball bat.
Like being stabbed with a hot sword.
The pain takes over, refusing to heal, destructive, cruel, sometimes without apparent cause.
You know, I was ready to just lay in bed in pain for the rest of my life.
Chronic pain is not a symptom, but a disease itself.
I mean, I've had broken bones, and I've had babies, and none of it's like this. This just keeps wearing on you. It makes you old.
Until recently, chronic pain has been a mystery to both patients and doctors. The mystery has led to misunderstandings. Because chronic pain is often invisible, people, including doctors, might say, the pain is in your head.
The hardest part during those years was also having doctors tell me there was nothing wrong with me.
Pain is in your head, real pain. Your brain filters your basic pain signals through feelings, thoughts, even your energy level. All these factors determine the pain's intensity. 21st century pain specialists understand this. They must be medical sleuths, ferreting out the sources of their patients' pain.
Every time I have a flare-up and I'm feeling the level of pain that I feel, and I feel it in the exact same spot, I say to myself, how can I not find out what is causing this pain? It's right there. This body isn't so big.
Vincent Prito is a busy man. Most days he's up before dawn, rousing his family for breakfast.
No thanks to the team. It's all coaching, I think, this year, huh?
And then out the door for the hour commute to his 60-hour-a-week accounting job in New York City.
Yeah, good play.
After a long day's work, he rushes home to coach his son's basketball game. Vincent is able to do all this thanks to new ideas about an ancient drug. Vincent is one of an estimated 40 million Americans suffering from chronic pain. To keep the pain under control, he depends on these pills. Without them, there'd be days he couldn't get out of bed. The drug that allows Vincent to have a life is morphine.
I don't think I'm any different than someone who has to take a blood pressure pill for high blood pressure, someone who has to take some other medication, someone who's diabetic who needs insulin every day. I just have a different problem.
See you later.
See you tonight, pal. Don't get hurt.
Vince's difficult journey to combat pain began one afternoon.
I'll see you later.
Meet you in the city for lunch, all right?
Right.
Okay, bye. I'll never forget that day, the day that ruined my life, so to speak. At least changed my life forever.
Vince and his co-workers were participating in an outdoor team building course.
One of the activities was a cargo net. I proceeded up the net. There were 3 people on the other side, nobody on my side, and nobody holding the net. So when those 3 jumped off the net, it became like a rubber band. And I lost my balance and I fell backwards. I felt like a pop in my back. And I had pain shoot down my leg. I guess 3 days later, I was up in the middle of the night screaming in total pain. My back, every muscle in my back was in spasms, completely hard as a rock.
That's when Vince started the trek from doctor to doctor.
Every doctor had a different answer. Every doctor had a different reason what was wrong. But no doctor was helping me. I had one doctor that gave me nerve blocks. I must have had 35 of them in my back, saying, oh, the next one's going to do it, the next one's going to do it. And it was just getting worse, my pain.
Vince estimates he saw 15 physicians. Most scrutinized his x-rays, trying to find a problem.
They took their x-rays, they took their pictures, and if they couldn't see it on a picture, well, you know, there's nothing wrong with you. What can I do?
Vince continued to work after his accident. Now, distraught and exhausted from looking for help, his pain was worse than ever. He was about to quit his job when his son asked,
and he said, you know, Dad, when are you going to be like a regular father? And that, like, struck me. And I just said, you know what? I'm letting this pain take over my life, and I'm letting it be the center of my life.
Vince made an appointment with Dr. Russell Portnoy, chairman of the pain department at the Beth Israel Hospital in New York City.
In the case of Mr. Prado, I'm convinced that there's something seriously wrong in his body causing this pain, but it's just beyond my ability to find.
Portnoy suggested that before Vincent give up, he consider narcotics or opioid drugs to manage the pain. For hundreds of years, doctors have known opioids can effectively reduce the pain response in most people. These drugs attach to specific receptors in the brain to block pain signals. You may still feel pain, but the pain's no longer bothersome. Vince was skeptical.
I said no. I mean, those things, those are what people take who have drug problems and stuff. I don't want something like that.
Portnoy understood. Despite their long history, there's a stigma against using opioids, even among fellow physicians. When Portnoy was in training, these drugs were only prescribed for the most serious illnesses.
We were just told it's wrong, don't do it. The drugs will make the patients into zombies. They'll all become addicted. You'll never get them off. You'll just harm people if you start them down that road.
According to Portnoy, this attitude is changing among pain specialists, but the rest of the medical community is still catching up.
That hurt up a little bit more.
How about down here? That's the usual.
Dr. Portnoy hopes that within the next 10 to 20 years, physicians in all specialties will recognize opioid therapy as an appropriate option for some patients with chronic pain, and that the public will recognize they don't always need to fear these drugs.
People who take narcotic medications for pain function better when the therapy is appropriate. They function better when these drugs are being taken, not worse. So they don't take the drugs and produce harm. They take the drugs and produce good. And they don't escalate the dose, and they don't lose control over their drug use.
Yeah. Look, Allie, look. Look at the bird. Look.
Several months after first seeing Dr. Portnoy, Vince started morphine therapy. On good days, Vince forgets he has a pain problem.
On three. 1, 2, 3, dominate!
In the case of Mr. Prado, I truly believe that very aggressive therapy using morphine has been a lifesaver.
Yeah, good play! I don't consider it a problem anymore. I just consider it a different way of life.
When the pain started, it was very slow in the way it formed. In the way it formed in my life, and in the way it formed in my body. The best way I can describe it is that my bones are made of glass, and all of a sudden they are hit with a baseball bat and they fracture into your skin, into your muscle tissue, and into your body. And it's shards of glass coming through.
You got art you're doing?
Yeah.
Okay.
Sandra Lena and her husband Kevin own a firm that designs and manufactures large-scale banners. Just as the business started to flourish, Sandra developed back pain. Beginning as a dull ache, the pain came out of nowhere As the days and months passed, the pain grew worse. Sandra's doctor prescribed exercise.
I could lift my right leg, but I couldn't lift my left, and I would lay there and cry. I was dragging one foot. I was walking with a cane. No matter what I tried to do, it just got worse. Soon I had no life.
2.5 frustrating years after her pain began, Sandra demanded an MRI. A fist-sized tumor was invading her pelvic bone. Over a decade before, Sandra had been treated for breast cancer. Now the cancer was back.
I thought the enemy was another lump. I did all of the things that I thought you were supposed to do, but no doctor ever sat me down and said pain could be the first indication of your cancer returning.
After her diagnosis, Sandra made an appointment with Dr. Dennis Cloisy, an orthopedic surgeon at the University of Minnesota Medical Center whose specialty is cancer pain.
As far as treating Sandra's pain, there are really two objectives. One is to treat the tumor, and the other is to treat the loss of bone where the tumor occurred in her pelvis.
Dr. Cloisy recommended immediate action. Following 5 weeks of radiation therapy, Sandra's tumor and the pain disappeared.
To live those first few days without the pain, I literally thought that I had died and gone to heaven.
But doctors can't treat all cancer bone pain as effectively. Radiation can manage one tumor, like Sandra's, but often cancer seeks several sites in the skeleton, and multiple tumors require more radiation than the body can tolerate. How can doctors stop bone destruction in these cases? Dr. Cloisy and his collaborator, neuroscientist Dr. Patrick Manti, are trying to answer this question. Working together, the physician and the researcher have made a number of landmark discoveries about cancer pain. They wondered why cancer pain is so agonizing and difficult to treat. Their experiments proved that cancer pain is different, that it actually has different neurochemistry than other major types of pain.
The beauty of what we're doing is we're able to dissect out what is different about it and to identify new targets that we can actually use these new drugs to go after.
Is it the tumor that you think that's actually breaking through the bone, or is it another cell that's...
Manti and Cloisy have also targeted the cells that cause bone destruction, osteoclasts. Healthy osteoclasts are involved in day-to-day bone maintenance. But cancer causes chemical changes in the bone, sending the osteoclasts into hyperdrive. Put simply, in the presence of cancer, the bone eats away at itself.
We've been able to identify that the osteoclast is one of the principal cells involved in causing the pain.
In Sandra's case, radiation treatment had stopped the osteoclasts and the pain. But the tumor left a hole where her bone used to be. Dr. Cloisy prescribed the best drug available to rebuild the bone. It would do its work in 2 to 3 months. Based on their research, Manti and Cloisy have developed an experimental drug, a molecule, that stops the diseased osteoclast in their tracks without radiation, and in just 2 to 3 days.
It basically stops the bone destruction, which ultimately gives rise to the pain.
The molecule is smart. Like other 21st century experimental drugs, it targets only the diseased cells, not the healthy ones.
The molecule comes in, it binds to the osteoclast, it does not allow it to basically break down bone. So the bone stays intact, normal, the tumor's still there, but the pain is not there because the osteoclast is not allowed to shift into hyperdrive.
The doctor's experimental treatment also reverses some of the ways lingering pain actually alters the nervous system. One of the most revealing discoveries of the last decade is that chronic pain can produce physical changes in the spinal cord and brain. Long after an injury has healed, the nerves may continue to send pain signals or make the body acutely hypersensitive to pain. Cloizzi and Mantei's experimental treatment reverses this process.
People with these diseases, they don't die within 6 months anymore. Many of them live for 6 years, 12 years, 20 years. And if pain is there for that full 6, 10, 20-year period, that makes a major impact on their life.
Sandra still has cancer, but with the pain gone, she's reclaimed her life.
The only time I ever stopped living was during the pain years, the 2.5 years of pain.
No one can be sure how long Sandra's current treatment will work. If the current regime stops being effective, the Cloizzi-Mantei experimental drug will be available to patients like Sandra in about 2 to 3 years.
I got cancer diagnosed, and all of a sudden now I have my life ahead of me. Now we know what we're dealing with. I still have cancer, but I have my life, and it's the most incredible thing.
If you have constant pain, it becomes your whole life because you're feeling it all the time. And no one else can see it, but you're always aware of it. So in a way, it starts to become over time who you are, who you think you are.
Ken Weinstein suffers from a condition called scoliosis, curvature of the spine. In his early teens, he developed back pain. For years, he learned to live with the discomfort, until he was 22 or 23.
I got this terrible spasm, and my back muscles clenched around my rib cage, and I couldn't breathe. When you get pain, you can't remember what life is without pain, and that's what this pain was triple that. It was just completely debilitating.
Ken, a publicist in the music business, became a new father and started his own business in the same year.
I work with a lot of bands, and there's always a lot going on. The phones are always ringing. There's the dealing with getting the business, keeping the business, doing your job.
He was aware that his back felt worse as the stress rose. Ken made an appointment with Sheila McLaughlin, a licensed acupuncturist.
Acupuncture doesn't cure anything. What it does is it sets up a state of balance in the body. Allopathic medicine would call that homeostasis. And it's about helping it get there.
Okay, I'm going to do a general treatment to help relax you.
Chinese medicine describes pathways of energy that run through the body similar to the way nerves or blood vessels do. These pathways of energy are called meridians. During acupuncture, needles are placed on meridian points to help stimulate energy flow. Acupuncturists believe pain is an obstruction of this flow.
So if you obstruct the flow, then you're going to get pain. You're going to get inflammation. Things aren't moving through properly. So if you can open that up and balance it, it will circulate through properly and be harmonized.
But it's not pain.
According to Ken, the treatment is soothing.
When you think of a needle going in your skin, you think of a great deal of pain, and this is not pain at all. But you feel the prick of the needle, but then you're immediately taken over by this sort of electronic sensation. It's like the meridians are talking to each other or something.
Well, one of the more important things I think about acupuncture that it does in terms of disease, it helps alleviate stress. So the outside part of stress in their lives does not change, but what it will do is it'll help change their relationship to it, how it affects them and how they feel about it.
From a Western perspective, we don't fully understand how acupuncture works. Experiments show some acupuncture points release endorphins, which in turn help reduce pain.
Western mind thinks of proving things. And the Eastern mind more thinks of doing it, and over time you see how it is, how it works. So it's more of a narrative. So you can never, I think, exactly break down how acupuncture works in that way and prove it in that way.
But in the 21st century, the main concern among patients is not how it works, but whether it makes them feel better. Acupuncture relieved Ken's pain, but only temporarily. Sheila guessed he might be undoing the effects of the treatment by re-injuring himself in between visits. So she sent him across the hall to her office mate, Hope Gellerman, a certified Alexander Technique teacher.
What happens when people are in pain is there's a whole kind of cycle that happens. The pain will trigger muscle tension. The muscle tension then feeds back into more pain.
I think acupuncture works very well with Alexander technique, particularly in cases where there's pain that has to do with postural misuse.
Sheila believed that Alexander training would teach Ken ways to prevent the repeated small injuries caused by the scoliosis, bad posture, and tension.
Kenny needed something to do to stop worrying about the fact that he was going to be hurting his back all the time.
Okay, so I'm going to take your head, not your neck, okay?
Hope begins each Alexander session with gentle manipulations focusing on head and neck alignment and breathing. Then she moves on to exercises that complement the normal activities of each student.
Okay, phone. You see, if your phone is farther away than that, you see you're going to lose your back support.
Right.
Do you see how that?
She was strengthening my back. She was putting Alexander technique into my daily life so I could sit properly at the computer, so I could walk better. I think, Hope definitely changed my life. There's no doubt about it.
More changes were coming. When Ken and his wife Lisa discovered they were having a baby, Sheila and Hope helped the couple prepare for new life.
I knew I was going to have a large weight that was going to shift my center of gravity, and I saw a lot of women in pain holding their backs, walking around, and I just did not want to feel like that.
Okay, so you can kind of see what's going on with your back when you look in the mirror.
Lisa discovered Alexander technique not only relieved her lower back pain, but also helped her avoid neck pain, insomnia, and migraines, discomforts many pregnant women learn to expect.
And often that their doctors tell them, well, that's just part of pregnancy.
Sheila also helped Lisa and Kenny deal with another pain issue.
The acupuncture was a great way to keep me calm during the pregnancy and sort of keep me focused on my new role in life.
Before delivery, Sheila taught Kenny to use meridian points to help Lisa through labor. Kenny used the tips of his fingers to perform acupressure on the meridian points. Without help from epidurals or any anesthetic, Lily was born.
I think no matter what, you're going to feel the pain of labor, but just knowing that you can try to help out. Pain management, I guess some people call it, that you can help further it along or shorten the amount of pain during the contractions. It was incredibly helpful to know that I had a resource.
Lily Weinstein is now 5 months old. Ken and Lisa's new challenge is to learn how to lift, hold, and carry Lily without hurting their backs.
They just love to be held, so you're walking back and forth and holding her, and your arms are getting tired, and you're asymmetrical all the time, and so you have to learn to compensate.
Lisa would like to pass on all she has learned from Sheila and Hope to the next generation.
I think one of my main goals as being a mother is to help her learn that she can heal herself.
Sheila and Hope represent another 21st century approach to pain. Pain specialists advocate the use of interventions other physicians may consider to be alternative or complementary.
If acupuncture can actually help the body to get better by itself, I think that's an optimum way to heal. And I think that is possibly something that will be really important in the 21st century, that to help people get better by themselves, to help them participate in their own health care.
We drive out through the country, and I would see the old cemeteries around there, and I would look and I'd say, well, at least they're not hurting.
The body's own electricity helps convey pain across nerve endings, over to the spine, and up to the brain. Like acupuncture, evolving medical technology exploits this system, so that rather than prescribing drugs or other therapies, some 21st century physicians use doses of electricity to treat chronic pain. Susie Arbogast and her husband Bob were on a camping trip when she came down with a blistering burn-like rash.
It was like being stabbed with a hot sword.
Susie spent the rest of their trip huddled in the corner of their camper. Susie had shingles, a disease that strikes adults when chickenpox virus, dormant sometimes for years, awakens. The condition may go away on its own, but in this case, the disease obstinately established itself in the nerves of Susie's spinal cord.
it was a screaming pain. It would make you, I really would want to scream. In fact, I did. I would have to hold my mouth shut and go,
With Susie Arbogast, her pain was in her shoulder. There were damaged nerves that had stimulated her nervous system, and there was a specific part of the nervous system, the sympathetic nervous system, that had become aroused. And our job was to turn that off.
Susie's doctors referred her to Dr. Scott Fishman, Chief of Pain Medicine at the UC Davis Medical Center.
Does that feel funny when I touch it?
No.
Or is it numb?
No.
It's numb. Mm-hmm. Yeah, I mean, you know, you had one of the worst cases of zoster I think I've ever heard of. And there's no question that in the time that it wasn't treated, the nerves were damaged.
Oh, yeah.
Dr. Fishman started Susie's treatment with oral medication, then proceeded with a series of specialized nerve blocks to quiet the inflamed area of her upper shoulder. Passing a very thin needle through Susie's throat, he bathed the affected part of her nervous system with a local anesthetic. Most pain treatments come with no guarantees. Dr. Fishman knew if the third block didn't keep the pain away, he would have to take Susie to the next step.
Then the next step would be to use this technology called the spinal cord stimulator, which fakes the nervous system out. It uses the same electrical noise that the nervous system uses to communicate with itself.
That noise, the electricity provided by the system, jams the pain signal and keeps it from reaching the brain. The spinal cord stimulator has two major components, a palm-sized battery and a narrow lead. Both are surgically placed close to the spine and feed small amounts of electrical signal to the nerves in that area. It's the same principle as rubbing your elbow after you've bumped it. The sensation of rubbing overrides and confuses the signals of pain. Unlike Susie Arbogast, Connie Page suffers from nerve damage of an unknown cause.
It's been to the point where I couldn't even go out of the house to go to the grocery store or to sit in a movie.
It causes burning pain in her feet that radiates up one leg.
It has just been off the wall, and the medications that they've poured into me either haven't worked or have made me very, very sick.
Connie has decided to try the stimulator. But before a battery is implanted long-term, stimulator candidates like Connie try the system temporarily. Dr. Karen Pantazes, an anesthesiologist, performs the trial.
Spinal cord stimulation is hopefully at least 50% effective in at least 50% of the patients.
Yes.
You're going to feel some numbness going into your back, but it's going to be a little bit sharp.
After she is lightly sedated, the doctors give Connie a local anesthetic.
I'm going very, very slowly here. There. Okay, I'm in the epidural space. Connie, you doing okay?
Fine.
All right, the worst part in terms of placing the needle is over.
Dr. Pantazes and her colleagues adjust the electrical feed and begin testing Connie's response to the first small jolts.
Wow.
Okay, what, is it in your right leg?
My right foot, my left foot, the right leg.
Connie's almost ready to go home. She'll experiment with the temporary stimulator for a week. If it provides relief, she'll return and have a more permanent battery, one that lasts 2 years, implanted.
An instruction booklet as well, and what I'm going to describe to you is all described also in this little booklet, so you can kind of...
Before she leaves the hospital, she learns to control the amount of electricity she'll receive.
Buttons here on the left, the blue buttons here.
We're now starting to see pictures of the brain after minute molecular changes have occurred. And we're seeing what happens to the brain in pain and what happens to the brain when we give pain treatments.
Other significant advances in 21st century medical technology have led to the development of a revolutionary diagnostic tool that offers new insights into chronic pain. Functional MRI, or fMRI, allows pain specialists to watch brain activity in real time. This is the first completely non-invasive, safe way to monitor the brain of someone like Gerald Malerba. Gerald is never without pain. Each morning he rolls off the couch where he sleeps because his pain is so intense he can't stand up. Gerald, once a construction worker and proud of his physical strength, was injured on the job. Since then, he's undergone 2 major surgeries to repair a collapsed spine. The pain may range from dull to excruciating.
Every day, you don't know what to expect. It might be pain level 5 to wake up with, and it might be pain level 20. I'm up.
Gerald is a volunteer in a breakthrough pain imaging study using fMRI and led by Dr. Vanya Apkarian. Apkarian and his team watch the brain's reaction to pain.
Good morning, Mr. Malerba.
Hi.
How are you?
Okay. How are you today, Dan?
Good. How are you feeling?
Pretty sore.
Yeah.
Yeah. I think you're going to get some good readings today.
Good. Good.
Dr. Apkarian has been studying pain for 20 years.
There's a whole new horizon opening up as far as understanding pain and treating pain. And that horizon very much has to do with the revolution in brain imaging technologies,
including fMRI. Like MRI, fMRI uses the body's magnetic fields to create images. But unlike MRI, fMRI can record activities like changes in blood flow to reveal how the brain is actually working. This provides an unprecedented opportunity. Gerald's fingers are fitted with a perceptometer, a simple device that helps him communicate his level of pain.
So show me a 0. Show me a 10. Great.
To gauge how their system works, the team asked Gerald to report what he's feeling during his MRI scan. Apkarian will later analyze the blood flow changes recorded by the fMRI and compare that to Gerald's responses. The experiment will last about an hour. After several minutes, Gerald's legs begin to spasm.
So now when it's shooting up, that means the pain just went up and then it's going back down. So Mr. Malerba has these spasms. The pain goes up and then comes back down.
As the experiment continues, Gerald's pain escalates, and the research team decides to call off the experiment.
Hey, Marquita, son.
Dr. Apkarian hopes the ability to observe the brain's responses may lead to an objective measurement of what has been invisible up to this time: pain. Why does Gerald put himself through this torture?
Why? So these fellows can find some possible help for somebody besides me. I'm kind of excited about the technology. If everything that bad happens to you, and everything negative, there's always a positive. Something always happens that's positive.
My life's changed a lot because of pain. It's basically affected every aspect of our life, our activity level, my work, starting a family. Pretty much everything has revolved around it.
Before chronic pain set in, Debbie Masarski was a flight attendant, an avid hiker, and a ballroom dancer. Now, an ingredient that usually conjures up delicious aromas and exotic tastes offers promise for overcoming her pain.
When I first started having the flushing symptoms, the doctors really couldn't explain to me why I was having them.
Debbie's quest to understand her pain began 6 years ago, when she began to notice a strange flushing and terrible burning in her feet. Though they were working blindly, her doctors urged her to try a wide variety of treatments, including medications, acupuncture, and orthotics.
We finally resorted to surgery and did multiple surgeries trying to address the nerve aspect of the pain.
None of the approaches worked.
We pretty much felt like we had exhausted all our resources.
Finally, by doing research on the internet, Debbie discovered she had an unusual disorder called erythroneuralgia.
It involves irritation of the nerves, usually in the feet, as well as swelling, redness, and other skin changes associated with some sort of inflammatory disorder.
The web also led Debbie to Dr. Wendy Robbins. Dr. Robbins, an anesthesiologist and the director of palliative care at UC San Francisco, is investigating the pain-killing effects of high-strength capsaicin. Capsaicin is the active ingredient in chili peppers. Debbie, who has flown in from Virginia with her husband John, is the 45th person to volunteer for the capsaicin clinical trial.
A cure would be wonderful, but we're kind of looking at it as hopefully a long-lasting treatment. What capsaicin does is it gets inside of the skin near where we apply it, and it works on the nerve fibers that signal heat pain. So what we do when we work with capsaicin is we selectively target bad nerve fibers that are sending signals that Debbie doesn't need anymore, and we turn those off without affecting the other normal nerve fibers.
The capsaicin the doctors apply to Debbie's skin is 100 times stronger than the capsaicin available without prescription to treat arthritis and muscle aches. It's 1,000 times stronger than the hottest chili peppers we eat. It's so powerful, it's dangerous to inhale or apply without anesthetics and careful monitoring. The capsaicin starts its work deadening the diseased nerve cells in Debbie's feet.
Right now they burn on the top of the feet, and the bottom still, I don't feel anything yet. They're still quite numb. Now you might say to me, why would I want to make a nerve die away if that means that she's not going to feel anything? And my answer to you is those nerves weren't working right to begin with. They weren't protecting her from getting in too hot of a bathtub or from spilling something hot on herself and not knowing it. All they were doing is severely disrupting her lifestyle.
The actual treatment takes about an hour. Some people require 2 or 3 applications. But the effects of the final treatment should last about 2 years, about the time it takes the nerves to grow back.
I'm so excited at the prospects. Good job. The thought of the flushing not happening constantly day in and day out, it's just, it'd be great. It often feels like I'm a single combat warrior in the sense that there aren't enough people doing the work, and so the volume of calls and letters from patients and from people who'd like to be patients is quite intense. Additionally, there's a fair amount of resistance from other parts of the medical community about whether or not these issues are legitimate. My advice would be to be proactive in your own treatment. I have really found over the years that if you just basically go on what you're told, a lot of times things can be missed or just treated and not necessarily cured or investigated well enough to know what you're really dealing with. We're very much anticipating that at least the pain will be reduced and we'll be able to maybe not focus on it so much day in and day out.
Think of the last time you had a headache or a toothache, and imagine that's 24 hours a day, 365 days a year, forever, because you're not going to die from it. Okay, what's that like?
Despite progress, our understanding of pain is still limited. There are times when even the best doctors cannot take away the pain. Then the only option is to learn to live with it. It's Monday morning, and a group has just arrived at Boot Camp for Back Pain. The Multidisciplinary Pain Center at the University of Washington.
This is what our day is supposed to be, and each of our names are here, and
Meet the new recruits.
so we have
Bill Weingartner, Lonnie Streggy, and Charmaine Stark.
Remember the kitchen?
When we start, we lay on our back, and you just do what you can.
Bill, who broke a vertebra in his lower back over 10 years ago, has traveled from Kona, Hawaii. Lonnie's upper back was hurt when an automatic garage door fell and slammed her to the ground. Charmaine was a neonatal intensive care nurse before slipping on a wet floor in the hospital and wrenching her back.
So bring your toes in, and then point your toes out.
There's a frustration that goes with not being able to deal with, my own life.
So what you do is you roll.
You get angry because it won't ever go away. And you can't sleep. And you can't sit. You can't stand. Stop doing the things that you used to do.
Apparently, I'm stuck with the pain. So my hope is that I learn some kind of coping mechanisms.
The three are here to learn skills to recharge their lives. Every day for 3 weeks, Monday through Saturday, they'll work out for 3 or 4 hours a day. The rest of the schedule is devoted to the biology and psychology of pain.
Important to keep that up, because if those get tight, then those tuck down onto the hips and cause the hips to be pulled downward, which causes more tension into your low back.
In some sense, this is where you send the healthcare system's failures. It's tough. If you think of somebody who's had pain for 3, 4, 5, 6 years, the fact that they have to come here early in the morning, spend the entire day, be active, so it's a very difficult task for these people.
Dr. Dennis Turk, one of the national leaders of the boot camp method, is a psychologist specializing in pain. He collaborates closely with Dr. Jim Robinson, an attending physician in the program.
I basically tell the patients, you've tried many of the things we do here. Your experience so far is largely one of failure. And it's very easy to say, well, nothing can work. But I want you to keep an open mind and be willing to take the plunge, to try new things.
Initially, everyone takes the plunge, but with trepidation.
Excited but scared. That's weird.
My morning here today, well, it wore me out.
The group is counting on the program. They've each been to chiropractors, orthopedists, neurologists, surgeons, all who have referred them to other doctors, none of whom could help. To be most effective, Jim Robinson feels he and other pain specialists need to step out of the traditional role as physicians who diagnose and cure.
So it's hard for physicians. We're trained to treat biology. And pain it breaks out of that mold. It can be strictly biological, but it can be many other things.
Multidisciplinary centers like this one are created to deal with the other things.
When you come in here, you feel like you are in a pain oasis, and you have cronies with you that are like you, and then the people here understand more of what's going on.
A team of psychologists, nurses, occupational therapists, physical therapists, and physicians work together, focusing on Charmaine, Bill, and Lonnie for the next 3 weeks. Day 2. It's 9 a.m. and the group starts the day in stretching class. One of the hallmarks of this program is to push through pain.
I'm tired and I'm sore because other muscles got worked yesterday that apparently haven't been working. I'm still hopeful. And then there's a little bit of concern because, you only go up from here, you don't go back.
Because something hurts doesn't mean it's harming you. A lot of physicians, a lot of physical therapists are used to, if it hurts, don't do it. And the philosophy here is that we've made sure we're not going to make you worse, but you're going to be using muscles you haven't used in a long time.
So don't be surprised if it hurts. By the time the group graduates, exercise will ease pain rather than aggravate it. Almost everyone finishes the program, but not everyone meets his or her goals. Since it began, Dr. Robinson and Turk have seen a wide range of outcomes. Nancy Garvey is one of their star graduates. Nancy, who has suffered from chronic pain since a car accident, is working out at the center today. She's also here to cheer on the new group, to let them know if she can do it, they can too.
We were all here for the same reason.
Yeah.
So are you doing better? Do you feel like you're doing better?
I feel like I have my life back.
For me, it was a great relief because I was so tired of that spiral of medications and side effects and emotional upset.
Statistically, most graduates improve their abilities to get on with their lives. What's the price? Programs like this one, which are covered by some insurance companies, cost $10,000 to $18,000 a person. But most back surgery costs $20,000 to $35,000. For people in chronic, hard-to-treat pain, there aren't options.
It's cruel, and we love to have a magic wand. I'd love to go, your pain's gone. But the reality is, current understanding of pain, current understanding of physiology and anatomy, we don't have a way to cure it.
But that will change in the next 5 to 10 years. Medicine's new focus on pain, the current research, and the development of the specialty will bring rapid-fire improvements. Aggressive, assured care using traditional and complementary approaches. Genetically engineered drugs without side effects. Smarter technology. Better training. Breakthroughs. Still, people must learn that much of the responsibility is up to them.
They have to be willing to complain to their physician. They have to be willing to assert their right to an expert evaluation.
My advice to patients in chronic pain is to get information about all the ideas that cover the gamut of the experience of pain, and find somebody who can be your ally and your consultant to help guide you, just like you would if you were going through a forest that you didn't know before.
The monster is there, but it's gotten smaller. And although this is less spectacular than cure, if you're a person who has a problem where there is no cure, it's a whole lot better to get optimal rehabilitation than to just stay where you are.